Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
On today's episode, we're going to talk about when can I have a shower after a joint replacement.
I like to shower at the end of the day after I've been operating all day and then have the shower, not between.
So not when can you have a shower, when can the patient have a shower after having a joint replacement? Really common question. People leave the hospital and they feel dirty, they want to get clean. Everyone's nervous about stuff that you get in the hospital.
All right.
Gotta wash.
It's a common question.
Right?
Not necessarily because you feel dirty, but it's just a common question.
I would disagree because I think you're in those beds and you're like, I just want to get home. I want to just start fresh.
Anyway, whatever your motivation is.
Okay.
People wonder, when can I shower after I've had surgery in general because I have an incision?
Yes.
So what's the worry about? Why is everyone so freaked out about having a shower after they have an incision, a hip or a knee or any surgery?
I think deep down, even if they don't say it, they're worried about either getting an infection or the wound opening up.
Yes, right. People are worried about getting water in that wound.
Yes.
Fair enough.
Okay, so you go home, usually your wound is covered. As soon as I get home, can I have a shower?
I mean, if you have a waterproof dressing on, yeah, you can have a shower. You can get that area wet as long as you, after your shower, check that dressing. If it's still totally intact and fine, then leave it. If not, just change it, pat it dry, change the dressing.
Okay, for some of our viewers who are not familiar, what do you mean a waterproof dressing? What does that mean?
A dressing that water can't get through.
Okay, so what he means is it looks kind of like saran wrap, for lack of a brand name, that has an adhesive surface that sticks to your skin, so you actually physically could pour water in and it would trickle off to the side.
Saran wrap's a brand name.
I know, that's what I couldn't find something, a generic name.
Yeah, plastic wrap.
Yeah, I guess plastic.
Okay, so you got a waterproof dressing on. If you have a waterproof dressing on, you can shower and then you change the dressing.
Okay, so if I have a shower and I have a waterproof dressing, do I have to change it afterwards?
Not necessarily. If it's still intact and it looks like water hasn't gotten in, you can just dry it off and it's still good, you can leave it.
Okay. How long do you keep that on for?
Well, normally we keep a dressing on for at least 2 days after an incision.
Okay.
Usually, our joint replacement patients will leave them on for up to a week or even 10 days, 11 days before they come back and see us in the clinic.
There can be a little trickle of liquid that's not uncommon. It's not necessarily a sign of something going wrong, or a little bit of blood. That's not uncommon.
Especially because you're usually on some form of blood thinner after. Yes. So you got the dressing on. So then the question is, okay, you've had dressing on, waterproof dressing. If it's not a waterproof dressing, can you shower?
I would say probably no. I mean, you have to clarify this with your surgeon. Yeah. Sometimes they'll say no, just leave it on until you see me. And other people would say you can have a shower with it on, but then as soon as you're done your shower, you gotta either take it off before or take it off right after, pat it dry, put in your dressing on.
I would say after 2 days. So first 2 days, you gotta have a waterproof dressing on the shower. After 2 days, if you have a non-waterproof dressing on, have a shower, but change the dressing right away and dry everything.
Yes.
Okay, that's my sort of rule.
Yeah.
As you can see, there's
clarify with your surgeon, particularly if there's something coming out of it. Some surgeons are not going to want you to do anything. They would rather have you just clean the area and then have a sponge bath or something like that.
Yeah. Okay. So now you've had the dressing on.
Yep.
You know what to do right after. You go to your follow-up and you get the clips out. Okay. So clips or stitches or whatever
Staples,
comes out.
whatever you want to call them. Yep.
Okay. Or you might have stitches that don't need to come out. They're dissolvable inside. But anyways, you've had your 2-week follow-up. And the wound looks good, everybody's happy. Can you shower right away now?
So our protocol, once your staples are out, because there's tiny little holes from the staples, we tell people, I think, 24 to 48 hours before you can shower or bath.
I say 48. 48 hours. Again, keep it covered for 2 days after those clips come out.
Yep.
Shower, then change the dressing, and then...
Change the dressing or take it off?
Sorry, take it off. 2 days, take it off.
As long as it's clean and dry.
Well, no, within the 2 days, if you're going to have a shower, within 2 days of getting your clips out, if you're going to have a shower, change the dressing.
Okay.
After 2 days, get rid of the dressing, and you can have a shower and just pad dry it after.
Okay. What about a hot tub?
Well, let's finish this video first.
No, not you. What about the patient? Because a lot of patients, especially in the winter, they're like, Canada is hard in the winter sometimes. I want to go outside and I want to have a hot tub.
Right. So a hot tub, I'm waiting a little bit longer on. So any really soaking the wound, I'm waiting long. You want that thing really healed, that it's epithelialized, so the skin is grown right over.
Yep.
It's touching. There's no more incision there, and now we're talking about a scar almost rather than an old incision.
Yeah.
Then I think you can start thinking about that, and that's going to be after the clips come out. I'm thinking before you immerse it, that's like 2 to 4 weeks.
Agreed. And same for swimming for me. Like,
Yeah.
you know, people are like, well, can I go do some water therapy? I'm like, great idea, but not yet.
Yeah, wait on that. Don't
Yeah.
soak that thing. All right, because you want it to be totally healed, and if it's soaked, water can get in. And the water in a hot tub,
Yes.
swimming pool, that water, although there may be chlorine in there, is not very clean. Okay?
Potentially.
Potentially.
Yes.
Potentially not clean. Ocean, forget about it.
Yes. Yeah. River, stream, pond.
Yeah.
No.
Wherever.
Okay.
That's it. There's your instructions on when you can shower, when you can get your incision wet. And we focus on hip and knee replacements, right? But it could be with any real incision that you have. You might want to follow these instructions and check with your surgeon because they might have a specific protocol.
For sure. In general, keep it clean and dry. If it gets dirty, if it falls off, clean it, cover it, and then talk to your surgeon. So we hope that this video was helpful.
And you got to get to the OR.
I got to get to the OR in like 5 minutes.
Yeah.
If you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.